Hello? Can you guys hear me?
Can you hear you?
Do you need to clear the audio?
Anybody signed in?
Yeah.
Oh, so I better open up the line?
Oh, that's why. Oh, yeah. Still here? Thanks.
Welcome to Bell Conference.
Okay.
Okay.
Unless I give a different name.
Thank you. Misty, the moderator has not yet joined the conference. Please continue. You are the first participant to join the conference. Please stand by. Nous sommes participants à vous joindre à la conférence. Veuillez patienter.
I'll put in as you. Okay.
Give me 1 second. Okay. So that's this one here. Can everyone hear me okay? I need to see you. Yeah, and it's just make sure it's recording on here. So it says your audio is working, so that's good. I'll just do that. There. Okay, so we have a couple minutes, so I'll just take over your computer.
Okay. Can you?
I'll just twist it.
What are you going to do?
I'm just going to have them on.
Oh, this one.
So I can-
Oh, I want to get out of this. Do you want the presentation? Or are you going to go into the webinar?
I'm on. Yeah. On the phone and computer. You get audio on the phone.
Okay, okay. So good afternoon, everyone. We're just waiting for a few more people. I think there's just a couple of people on the line so far. Hi, Helen. How are you?
I'm good, thank you. Can you hear me okay?
I can, and I can see you.
Oh, perfect. I might turn my video off, but I was just trying to mess around with this and get it going here. But it's good, it's working fine.
We have a couple more people on the phone. Okay. Oh.
I'm still here. I just turned off my video. I think that's okay?
Yeah, that's fine. That's
okay.
Fine. Oh, yeah. So we're just going to wait a few minutes.
You want to start the video? What are you doing?
No, it's a live meeting.
Perfect. Okay, got to put in the... Since start my video, I don't know if you want to start your video. Yeah, there's another thing that you have to download.
Oh, it's where it's
You can probably do it, but
Yeah.
I would use this and sort of like.
okay.
The reason why you look at that way is because cameras over here.
Okay.
Right?
Okay, I think we're ready to get started. We have a number of people that are on the line now. We're going to, this is Karyn speaking, we're going to record this webinar, so it'll be available to people after today. So if I could just ask you to please mute both your phone and the sound on your computer. Or the microphone on your computer, I think. Is that right? Okay. Okay, so good afternoon. My name is Karyn Kennedy, and I'm the CEO of Boost Child and Youth Advocacy Center here in Toronto. And I think as most of you know, we are involved in a project with funding from Justice Canada to provide a series of training webinars over 2 years to child advocacy centers and child and youth advocacy centers across the country. So this is the second of the webinars, and it's part 2 of the first webinar, which really was looking at developing an effective child and youth advocacy center. So it's really intended for people that are in the earlier stages of developing their center. Oh, I just got a message from somebody saying they're not able to hear me. Just see. Is that better? Okay, I'm not sure. If you can't hear me, please send me a message and let me know. But I have turned up the volume. So there's a number of topics that I'm going to cover today in this webinar under the heading Determining and Developing an Effective Child and Youth Advocacy Center Model. And I'm going to use both Child Advocacy Center and Child and Youth Advocacy Center interchangeably. I'll probably use CYAC or Child and Youth Advocacy Center more often because that's what we call our center, so that's what I'm the most used to. So we're going to begin with a bit of a review of the components of an advocacy center, what the goals are, Some of this will be, for those of you who were on the first webinar, it might be a bit of a repeat, but it doesn't hurt to review. And then looking at developing a service model, conducting investigations, case reviews, a little bit on training and professional development, and then just to finish up, I'm going to talk a little bit about stakeholder and media communication. So what's a Child and Youth Advocacy Center? It's a place where multidisciplinary service is offered with a team of highly skilled and trained law enforcement, criminal justice, child protection, medical, mental health, victim services, and or advocacy professionals work together to coordinate and collaborate on child abuse cases for the benefit of children, youth, and their families, the community, and the broader systems. And in centers across the country, some organizations use the term victim services, some use advocates. Sometimes they mean the same thing and sometimes they don't. I'm going to talk about advocates and victim services as the same kind of program, and I'll talk a little bit more about that as we go on. So a CYAC integrates all of these services into a continuum, usually in one central hub where investigation, protection, victim support, medical, mental health assessment, and treatment, as well as follow-up care can all be offered together. This is a diagram that just gives you a bit of an idea, a visual idea of what most centers would include, whether it's all in one location, whether it's co-located in one location, or whether it's delivered, or whether services are coming from different places in the community. Most CACs would include these service partners, so child protection, police, court support, court preparation and support, mental health services, medical services, advocacy, all surrounding the child and family, with them obviously being in the center. The goals of a Child Advocacy Center are essentially to provide a child-friendly facility, a place that's comfortable for children and youth, both psychologically and physically, that it's safe for them to come to, unlike police stations or even schools in some cases. The multidisciplinary team works together in the CYAC, and as I've mentioned, includes police, child protection, medical, mental health professionals, as well as victim advocates. One of the benefits, I think, that we've certainly seen in CYAC, CACs across the United States and more recently in Canada in the last number of years, is that having the professionals co-located together as a multidisciplinary team really promotes the ability for people to gain more expertise, gain more experience, develop their skills. So CYACs, by their very nature, include highly skilled and trained forensic interviewers who can gather information together, avoiding repeating interviews, not having the child go through more than one interview except when it's intentional. So the child doesn't have to keep repeating the story over and over, as in some places they've had to in the past. CACs provide medical evaluation either at the center itself or through collaboration with specialized medical service providers, could be a hospital, and some centers actually include both. In Toronto, we have a nurse practitioner who is at our CYAC part of the time during the week. She can also come when she's needed on an on-call basis. However, not every child can be seen here because they require x-rays or they require some other medical procedure that has to be done at a hospital. But what the nurse practitioner is able to do then is facilitate that process, so there's a much more expedited way of the child going to the hospital and being seen at the hospital without having to go through the emergency department, having to wait possibly even hours. CYACs also offer specialized mental health services, again, either in the center itself or in cooperation with service providers in the community. Sometimes that's a bridge that's created by the advocate or the mental health agency itself may have somebody in the center who's then able to refer back to the agency in the community. There's a number of different ways that this can happen, but the goal is to ensure that there is a seamless process for the child and family to receive the mental health services that they need without having to look for them themselves or without having to be placed on long waiting lists. Another goal is to provide ongoing and consistent victim support and advocacy. And we do this at our center, and a number of other centers do as well, through the position of an advocate. I know there are centers in the country that have victim services workers who perform this role. Essentially, it's providing a service where there is somebody right from the beginning when the child and family first come in for an investigation or first meet with the investigative team to be interviewed, that can provide support on an ongoing basis for as long as the child and family need it. And I'll talk a little bit more later about the role of the victim support person or the victim advocate, but essentially they're the person who sort of holds all of the information together, make sure that children and families are kept up to date on things that are happening, and make sure that they don't slip through the cracks. Another goal of a Child Advocacy Center is to offer case reviews with the multidisciplinary team on a regular basis so that the team can share information, they can plan, and they can coordinate services together for the family. And the MDT itself may vary depending on the individual case. At the very least, the multidisciplinary team would include the investigators, police, child protection, advocate, usually medical practitioner, nurse practitioner, or physician, the advocate, and mental health counselors. But there are some instances where it might make sense to invite others to be part of a case review, such as a teacher or a principal or somebody else in the community that has a strong connection with the family and may be involved in helping to plan and coordinate services for them. CYACs also provide case tracking and evaluation so that cases can be monitored. We can collect service outcomes, we can evaluate the efficacy of the program, and we can track cases as they move through the process, particularly through the criminal justice system. We want to make sure that we're collecting information such as when the child and family have to go to court. We want to make sure that they're referred to court preparation services so they get what they need in order to be able to go through that. So I'm going to now move to developing the service model. And this is a process that every center needs to go through in order to determine what kind of a center do they want to be, what sort of services do they want to offer, what's the model that's going to work in your community and is going to meet the needs that you've identified. So the first thing that you'd need to do in your community is really figure out what is it that you're trying to do, what is it you want your center to accomplish. For example, is your goal to reduce the number of times that a child is interviewed or the number of people and places that they encounter? There's been some significant research that's done in the U.S. that identified, and I think some in Canada as well, that identified the number of different places that a child and family have to go to during a child abuse investigation. And on average, most families were going to 8 different places. So if the goal of the CYAC is to reduce that, then you'll want to look at developing a model that's going to bring people together so the child doesn't have to go to a number of different locations. If your goal is to improve the investigation so you have better quality interviews, perhaps more guilty pleas, then you may want to look at how can you develop a model that's going to improve and enhance the forensic interview component of the process. In order to develop a model that everybody is going to agree to and support, you need to make sure that everybody's on the same page, that your community partners all agree on what the issues are that you have identified in your community and what you want your model to address. And there's a number of ways that you can go about identifying what the issues are in your community. You may already know. I mean, you may already be working closely with your service partners, and you may already have a pretty good idea. But it's always helpful to find a way to confirm that so you can develop a model that you can demonstrate is actually addressing the needs. So one of the things that we did a number of years ago with our center, and I think other communities have done similar kinds of evaluations, is we surveyed our frontline police officers, our child protection workers, to find out what was working well and what wasn't working. And at that time, we'd had a protocol in Toronto for many, many years that set out guidelines for joint investigations and how police and child protection workers were to work together to conduct joint investigations, and ideally in child-friendly setting. What we found through the survey was that children were being interviewed in police stations, they were being interviewed more than once, sometimes by police, then again by child protection, and service providers weren't working together, nor were they communicating effectively. So there were parallel processes that were happening in terms of the investigation rather than it being a joint investigation. So this was the tipping point for our community that brought people together and led to a decision that we need a model that is going to improve communication between service providers, that's going to provide a child-friendly location, and is going to ultimately increase the number of investigations that are conducted jointly, and will bring services together under one roof. So if you don't have a clear agreement to begin with on what it is that your service model is hoping to address, then it's going to be much more difficult for you to agree on what the model actually needs to be. Not all centers are able to offer the same services. You know, in larger centers, it's less difficult to provide co-located models where you can bring together all of the different partners that are involved in responding to child abuse investigations under one roof. But I know that there are centers in other parts of the country, even in other parts of Ontario, where there may be multiple police services working to cover a geographic area. Or there may be it may be a rural area where there's, you know, large distances that people have to travel to get to one place. So having everybody located in one center may not be the answer for every community. I know in the north, from some conversations I've had, you know, there are all kinds of challenges, particularly when, you know, you're looking at some communities that are fly-in communities. So there isn't a cookie cutter approach. There isn't one model, one size that's going to fit everybody. It's really important to identify what are the issues you want to resolve, or you want to improve, and how can you do things in a creative, innovative way in your community to create at least the components of a CYAC model, even if they're not all under the same roof. Having said that, though, I think it's important to identify what a comprehensive range of services includes, what resources you do have. Maybe there are already partners that are providing those services in the community, and maybe they're already talking to each other, but perhaps having a child-friendly location where investigations can be conducted, forensic interviews can be videotaped, and case reviews maybe can be coordinated and people brought together may improve the way that you're doing things now. Having access to court support and counseling services, medical evaluation, and coordinating those, if not in one location, at least through one process. And I think most importantly, establishing mechanisms where people can learn to work together more effectively, where they can build stronger relationships, where they understand more about each other's roles and how each other the responsibilities each system is has to follow through on really helps to build that expertise and I think develop stronger relationships that ultimately improve the process for children and families. One of the most challenging things I think that we found was creating what those structures and processes are for people to work together, even if you're not in a co-located model. We established a number of different mechanisms. One was a joint management team. So the supervisors of the various teams that are involved in the CYAC meet now on a regular basis, but even for the 2 years before the center actually opened, met regularly to develop the service model, to plan training for staff, and really to problem solve around what some of the issues might be that we would be facing once the center was open. So having that mechanism was helpful. Figuring out what the decision-making process is going to be and who's going to be able to make decisions, and do those people get together on a regular basis and talk. And many of these things already exist in various communities, so it's not a brand new concept bringing two people together, but bringing them together around a common goal and really focusing on that and figuring out how you're going to work together on an ongoing basis, I think is incredibly important. Formal and informal meetings. So once the center is open, you're going, but how are things working? And that may be your supervisors that are meeting on a regular basis. It may be directors or the chief or whoever is in charge of the different organizations that are providing services in the CYAC. It may be the frontline staff, and there are many things that you won't be able to necessarily anticipate and that you'll have to address and problems around once they occur, but having processes in place to deal with that is really helpful. Review how cases can promote communication and build trust. Regularly provide feedback with respect to the operations of the center, looking at both the practical, operational, administrative matters. How is the facility being used? Do we have the right equipment? Are there transportation issues for clients? How are all of those things working? Maybe something that your managers would address on a regular basis, but you may have other mechanisms to do that. How is the MDT working together? Are people communicating? Are they talking to one another? Are they sharing information? Are there training needs that you have to address in order to improve some of those relationships and some of the understanding of how systems work together? So as I've mentioned, beginning with developing your service model, you're gonna look at what the needs are in your community, what you want to provide, and what your partners are able to contribute to that. By looking at the gaps in the community, you can determine what the services are needed, and then you can look at what is your CYAC or your CAC in a position to be able to offer. You may want to do a needs assessment or a feasibility study. You may also want to do that around funding, and particularly if you're going to need to fundraise. Is there an understanding, is there an awareness in the community, is there capacity in the community to be able to raise the funds that you need to establish your center? So needs assessments and feasibility studies, a number of centers across the country have done these now. I think the newer centers that are coming on board now may be able to borrow from what other centers have already developed rather than starting from scratch. So if you're in a position where you're just beginning and you don't know whether you need a needs assessment or a feasibility study, you're not sure what it's going to provide, you may want to talk to some of the centers that have already done this and see what they may be able to share with you. So just to to kind of summarize this section, as I mentioned, you may not be able to provide a comprehensive range of services in one location. You may not even be able to provide all of the services that you need because there might be resource issues or other limitations. But if you can identify what the greatest needs are and how your center can meet those needs, then you can still make a significant difference in how services are being provided in your community. One of the areas that is often a challenge for CACs is providing mental health services. And it may be that those services don't exist or they're very limited in your community. It may be that there's long waiting lists for them. And it may be that, that you just don't have the ability or the capacity to have that service provided directly out of your center. Where those issues exist, establishing links in the community might be an approach that you can take to ensure that there's an understanding of what the CYAC is offering and what the needs of children and families are in terms of trauma issues and how those needs can be met. And then developing processes so there's communication between the service providers and the CYAC, and this is where advocates or victim service providers can be very helpful in having someone who can make those referrals, seek out those services, identify them, perhaps even attend with families to the first appointment at a community service agency or a mental health agency. Some communities, it's very limited, and there may be individual service providers who can provide this support. It may not be funded. There may, you have to be creative in looking at how you can connect the CYAC or the CAC with mental health services, counseling services in your community. Because without that, we're really only doing half of the work. There needs to be a way for children and families to access, ideally without long wait lists, trauma counseling. So once they've gone through the investigative process, even if they still have the criminal justice system ahead of them, getting the support that they need to deal with the trauma issues that they've experienced is critical. Including those service partners or those service providers as partners also helps them to engage in the CYAC model. And I think one of the goals is really to have all of your service providers own the model and feel invested in it, because it will help them to see the value in providing services either in the center or in the community, but to the children and families that will come through your center. I think also in terms of funders, particularly government funders, having a strong partnership, being able to go to your local government, town, municipal, provincial government and say, all of these service partners have come together to support this model can be very powerful and help to demonstrate that, this kind of collaboration really is a much better way to provide service. Having on-site medical evaluation, as I mentioned earlier, might not be possible, but there may be a medical practitioner in your community. If you're in a small community, it may be through your local hospital. Larger communities, there may be departments in hospitals that can be part of the CYAC. I know there's at least one center in Canada that's located in a hospital, but having access to those medical services is essential. And having the investigative team, police, child protection, understand the benefit of the medical services and when they need to be accessed is something that can be enhanced when you have a medical professional as part of your multidisciplinary team and they're able to provide more education and awareness about what their role is. For example, one of the things that we discovered is that having our investigators contact our nurse practitioner early on in the investigative process and consult with her about whether a medical evaluation was needed was really important because they were often making that decision themselves and not necessarily having enough information or thinking about what they might be looking for, and cases were getting missed. So having access to the medical professionals and being able to consult with him through the investigative process is very, very important. And ideally, if you have a medical professional who can provide services out of your center, or at least have access to a hospital where children can be seen there quickly and without having to go through an emergency department or having to wait for a long time, is the best way to do things. It's also important when you're conducting case reviews to have that input from a physician or a nurse practitioner in terms of case planning and looking at the overall needs of the child and family. And I would say the same thing is true for all other professionals, whether it's victim support workers, whether it's advocates, whether it's counselors or mental health therapists. Having that appreciation and understanding of each other's role and being able to work together and share information and plan together, not just in terms of the beginning of the investigation, but throughout the whole process, does a number of things. One is it actually saves time because people are sharing information together at one time rather than everybody needing to access bits and pieces of information on their own. It improves the quality of service to children and families because people are working together and planning together. Once you've determined what the services are that your center wants to offer or plans to offer, either in one location or by linking with different organizations in your community, it's going to be necessary for you to create a map or a flow of service so everyone understands what the process is. And every center is going to do this a little bit differently depending on how things work in your particular community. In some centers, it may be that the case is referred from another organization, Child and Family Services, Child Protection, Children's Aid, whatever it's called in your particular area. Referrals may come in from those systems into the CYAC. You may decide that you don't have the capacity to see every child abuse case that may present itself. When we started, we identified physical and sexual abuse, and we were only going to look at emergency responses or 12-hour responses because we didn't feel that we had the capacity necessarily to provide support to every case that might come through the system. So those are some of the things you're going to need to determine is what cases you are going to be able to see and how are they going to come into your center. And maybe in many provinces in Canada, the Child and Family Services is delivered through the provincial government and is actually located right there in the center, and the referrals may come directly there. In other centers, the process may be slightly different. But you need to map that out so everybody will understand what the flow of service looks like. So one of the things that can be helpful in doing this is looking at how cases are managed right now in your community. And would that change? And if so, what would that look like? How would that be different than what you're doing now? In some places, the calls or the reports may go first to the police, and then they share the information with the child protection workers. I know that in some centers, they have triage meetings first thing in the morning every single day. So they look at all of the cases that have come in and they determine, okay, which ones need a response right away, which ones can wait a little bit, which ones maybe need a different response than what a CYAC can offer. So that would be the first place to start, is looking at what the flow of service is going to look like for your center and making sure that everybody has the same understanding. The goal, obviously, is to make the process easier for children and families and to improve coordination between professionals. You want to look at how the process that you're going to develop and offer through your CYAC is going to reduce trauma, because as we all know, it can be very difficult, can be as difficult for children and families to go through the system as it was to experience the abuse. So we want to make sure that we're creating processes and offering services that are all intended to reduce that level of trauma and make sure that that things are better for kids, not simply different. So I talked a little bit about needing to figure out what the referral process looks like. In centers where there are on-site multidisciplinary teams, reports are usually received by either police or child protection supervisors, and then they would be assigned to an investigative team who then assumes responsibility for the investigation and makes the decisions about that case, beginning with how the forensic interviews are going to be conducted and moving forward. It may also the advocate may also be assigned to the case at that time, and then the team increases and the advocate becomes a member of that team. Once the investigation begins and decisions are made about how that's going to occur, other professionals may be brought into the team, such as medical or mental health workers, either for consultation or to see the child and family directly. And that's where I mentioned a few minutes ago, the consultation with medical practitioners is very important because the information that the investigators have may help to determine whether the child is going to need a medical evaluation at that point or whether it can wait until a later time. The investigative team makes all of the decisions related to the initial interviews, including where it's going to take place. And ideally, we like to see children and their families come into the center and the interviews, the forensic interviews, happen in a child-friendly setting. That's not always possible, and in fact, in some communities, it's not possible most of the time. So there may be other ways that you can conduct interviews without having them in one center that are still going to be child-friendly and reduce trauma for the child and family. This next slide is a pictorial description of what a service flow may look like, beginning with, I know it might be a little bit hard to see, but beginning on the left with the calls coming in, the reports of suspected child abuse coming into the CYAC from either police or child protection. In Ontario, we have Children's Aid Society, so CAS represents that. The case is then assigned to an investigative team. They're going to begin to conduct a joint investigation. They're going to contact an advocate who will be, whose role will be to support the child and family. And in our model, and this varies from center to center, the advocate is included right from the beginning. So they're actually the first person that the child and the family meet when they come to the center. Or in some cases, it's a child and a foster parent, or maybe a child and some other caregiver. But generally, the child comes with a supportive adult, and the advocate greets them, introduces them to the interview team, helps them to get settled and feel comfortable in the center before the interviews begin. They're ideally, and this doesn't happen in every single case, but ideally there would be a multidisciplinary team debrief at some point in the process, either just before the interview or right after the interview, to quickly share information and make some decisions about next steps. If there's a medical evaluation at that point, that professional would also be part of the team debrief. Following that, the police and child protection would continue with their investigation. There may be collaterals. They may need to interview the accused at that point. The advocate assumes responsibility for supporting the child and the family. They may consult with a mental health provider at that point. The family may need crisis support. The child may be self-harming or suicidal and need some immediate support around that. So that would be the advocate's role, to bring in the mental health provider and figure out what the next steps are. Following the investigation, and this can happen the next day, it could happen a week later, it could happen 2 weeks later. It depends on what the needs are of that particular family, but there would be a first case review with the multidisciplinary team to bring everybody together, to sit down and share information about what they know at that point. There may have been decisions made by then about charges being laid. The child may have been apprehended. So there will be more information available that the professionals can share with each other at that point. And then they would begin to make plans for what's going to happen next. And depending on what the situation is, different service providers will have different actions to take. The advocate stays involved as the support for the child and family. There may be a need to make referrals for ongoing mental health services, victim witness preparation, and in some cases, families need services that are completely outside of sort of the formal service system. They may need help with housing. They need help with food or education, or finding a ongoing physician. There's all kinds of needs that families present with, particularly when you're working in areas where there's a lot of diversity, and you may need to find a service provider who can speak the same language that a family speaks. So there's lots of other kinds of needs that families present with that the advocate can be very helpful in finding services to meet those needs. At that point, most of the decisions will have been made about how the case is going to progress. The child and family can continue to receive support from an advocate until they don't need it any longer. They may be doing just fine. In our center, the advocate stays involved and checks in with the family on a regular basis until the family decides that they don't need that support, or until they're connected with another organization, perhaps in the community, that can take on that role. So this is just one example of a service flow model, and the one that in particular we use in our center, but yours is going to look different depending on how you decide to offer services and how you decide that you're going to manage reports of abuse as they come to your center. So most of this I think I talked a little bit about already. Investigations in the center, and again, I'm basing this on the model that we utilize here, but it's going to vary depending on what the needs are in your particular community and your center. So the way that most centers would operate is a report of suspected child abuse is made to someone. Either it's a child protection agency or it's police, and it comes to the CYAC and is assigned to an investigative team. In centers where advocates are available, as I mentioned, the advocate then is included in the investigative team and offers support to the child and family. And one of the things I should mention is that the advocate services are all done on a voluntary basis, where in most cases families don't have choice in participating in a forensic interview when a report of child abuse is made. They do have a choice of whether they want the support of the advocate or not. So if they do, then consents are signed at that point so information can be shared. And different centers, again, handle this in different ways. In our center, we only share information beyond police and child protection, by consent. Our child abuse protocol allows our police services and our 4 child protection agencies to communicate freely during a child abuse investigation, so they don't require consent to be able to talk to each other. But every other service that's involved in the CYAC, the advocate, mental health, medical services, do require consent, and families can choose who they want to give consent to speak to one another. In our experience, most of the time, families are fine giving consent so everybody can talk with one another. But if you don't have that consent, it does make it more difficult, and you need to figure out how you're going to manage those kinds of cases. One way that some centers have handled that is to talk about particular cases without identifying information, which makes it challenging, but still gives everybody an opportunity to share their thoughts and understand what's happening with the case and perhaps even make plans. When an investigation is going to happen at the center, then the investigative team notifies the advocate when the family is coming in. If it's the same day, sometimes it could be, you know, in the next hour. In other cases, it might be the next day. It depends on how busy your center is, and it depends on how many reports you get and how you respond. When the child and family come, as I mentioned, the advocate greets them and introduces them to the forensic interview team. Before the first interviews are conducted, the police and child protection agencies meet, and they don't do anything that they wouldn't have done before. The difference is in a CAC is they're doing it together. Now, they may have, when the information first came in, they likely would have checked their respective databases for any history on the child and family, but then from that point on, they're working together as a team. So they're looking at together what is the history, sharing information with each other. One may have different information than the other system. They're looking at the safety of the child. Are there other children in the home? What are the needs of the family? Particularly in a city like Toronto, we have a lot of families that have come from other countries and may have different language needs, may have different cultural needs. Sometimes we see children with special needs, and we need to look at, you know, what are the needs of this particular family and how can we best meet those needs. They're going to make decisions about where and when the interview should occur. Does it have to be done that same day? Can it wait until the next day? Is the child at school and going home potentially to an abusive situation? Do they need to go out to the school? We do almost as many interviews in schools as we do in our center because we can't remove children from schools and bring them to the center for an interview without the parent's permission, without it being an apprehension. So that's something that we're always working around. Decisions need to be made about who's going to lead the interview. And I know in some provinces this is very clear, and it's always one system or the other. In Toronto, where we have a joint protocol, it's really a discussion that happens between the two investigators, and the decision is often made based on skill or comfort, either the interviewer's comfort or the child's comfort. And this is where sometimes the advocate is able to provide some information that's helpful even before the child is interviewed. If the interviewers begin with a non-offending caregiver interview, let's say, and the advocate is sitting with the child, they're able, and they're never discussing the evidence with them, but they're able to do a little bit of an assessment of the child's cognitive and language ability, the child's comfort. Is the child very shy? Do they feel they'd be more comfortable talking to a female investigator or a male investigator? So the advocate can provide some input into the decisions that are made about how the forensic interview is going to be conducted. I know in some centers they have forensic interviewers and they're the only ones that interview the child. But again, this is something that varies across the province depending on different jurisdictions and different practices. So that may be something that you'll need to make decisions about in your center, or it's just going to be done a certain way and you don't need to make those decisions. If the family is going to be contacted and invited to come or asked to come to the center the next day for an investigation, who's going to make that call? Consultation with medical and mental health, I've talked about previously, that it's often, particularly with medical, important to consult even before the child is seen. In terms of the process, when the child is waiting to be interviewed, if the caregiver is being interviewed first, the advocate would sit with the child. While the child is being interviewed, the advocate would sit with the caregiver. One of the first things that they would do would be to advise that they cannot discuss details of the abuse. They would review our confidentiality and duty to report policy and duty to report obligations, and provide some general information about the Child and Youth Advocacy Program, the services that are available in the center, and how those work. The advocate also at that time would be gaining consent from the caregiver for all services, ideally advocacy, mental health, medical, so that the MDT, the multidisciplinary team, can share information freely with each other, and possibly even involved collaterals if there is perhaps a family physician, or maybe the family has a therapist in the community that they're seeing. So we would want to know about that and obtain consent to be able to share information with those professionals as well. Once the joint investigative interviews have been completed, ideally a debrief meeting should be held with the MDT to share information that's been gathered up until that point and plan next steps. So this may be a meeting where the police advise that they plan to make an arrest, or the Child Protection Agency feels that they need to apprehend, or the advocate may have some information that has been provided by the youth or family that they need to indicate that there may be some potential crisis or mental health concerns. It's not unusual for the advocates to get information from youth about self-harming behavior, or from the parent about previous suicidal concerns, family violence. So bringing everybody together, even if it's for 5 or 10 minutes, to just share that information is extremely important. Once that meeting occurs, and as I said, it may just be a very brief meeting, then the team would let the family know what the next steps are going to be, with obviously whatever information is appropriate to be shared at that point. If there is an immediate crisis that's identified, then if you have mental health therapists on site or easily accessible in your community, you may want to bring them in at that point and connect them directly to the family. In some cases, there may be serious suicidal concerns and the child needs to go immediately to a hospital. And those decisions and those recommendations can be made at that point. Once the investigation has been completed, that's when there needs to be a case review process. And depending on the model that you choose and depending on the volume of cases that you see, you may have these more often than not. Because we are not able to case review every single case that comes in, we just don't have time to do that. We made a decision that every single case where criminal charges are laid would be reviewed, and any other cases that the professionals involved feel need a case review, they can be brought forward. Some cases require multiple case reviews on an ongoing basis. Others, it may be one case review, plans can be made, and then things go on from there. It's important, though, I think, to build in a mechanism so you can have regular case reviews with the MDT members and collaterals. And this is where I think CYAC's adds so much value to the process in being able to have everyone sit down together and share from a variety of perspectives. And it goes a long way to help professionals understand each other's roles. It goes a long way to educate and increase, I think, people's abilities and understanding of trauma, for example, why decisions are being made to lay criminal charges or not lay criminal charges. One of the surprising results that we saw in the first year that our center was open was there were far less criminal charges in physical abuse cases than we had anticipated. And when we dug a little deeper and looked at that, we realized it was because the case review process, other recommendations and other suggestions were being made about how to work with the family to prevent further physical abuse in ways that engage the family and really accomplish the goals that we were hoping to accomplish without going through the criminal justice system. So having an opportunity to bring people together and talk about cases from looking at it through different lenses, I think is really one of the most important factors of a CYAC. Case reviews are, as I mentioned, collaborative. They're a formal process where information and expertise is shared. Usually brief notes are kept. Depending on the center, you may decide how you're going to handle that. It's always, when cases are still before the courts, it's always a concern about documentation and how much documentation. So in our case reviews, we document factual information and then just what the action is that's going to be taken. So there's not a lot of narrative detail that's documented, even if the discussion may include that. And really the case reviews, the whole purpose of the case review is to make decisions that are in the best interest of the child, youth, and family. Case reviews are also an opportunity to track and monitor cases, and as I mentioned, provide mutual support and promote shared responsibility. So the goals of the case review are, first of all, to provide a comfortable and safe place for people to discuss cases, including problems, issues, and concerns. Surprisingly, not all organizations agree on how they want to approach a particular case. And creating that safe place with people who have been working together regularly, understand each other's roles, and still helps them to move forward to accomplish the goals. Addresses the needs of the child and their families in an appropriate, timely, efficient, and coordinated manner, and reduces the trauma and confusion for children and families. One of the discussions that we've had over the past year is whether caregivers should be invited to attend case reviews. And initially we didn't think about this and had no plan to, but caregivers started to ask about whether they could be there. And we recognized that it could be very empowering for caregivers to be there in some instances. So we've now moved to a process where the initial case review is only professionals, but if there are going to be ongoing case reviews beyond that, and we feel that it can be beneficial to the child and the caregivers to be involved, then we would be inviting them to attend. So as I've mentioned already, just to recap, case reviews offer direction, help determine the course of action, and provide an opportunity for cross-disciplinary education to help each other understand each other's roles, as well as have an appreciation for the complexity of cases and some of the needs of the families may not have been initially. So this is a list of criteria that you may want, and you would hold a case review when there's immediate safety plans, including the possibility of apprehension, where there's been a criminal charge, where there's concerns about the caregiver's ability to support the child, where the abuse has resulted in a serious physical injury, concerns about the child or the caregiver's emotional or mental stability, where there's high stability. So we've had a number of cases that the media was this. So those cases sometimes the MDT can determine and okay, so somebody just said they can hear, so I'm hoping the rest of you can. It's also helpful to have a case review when the case is being transferred to. Now in Ontario, and this obviously will differ across the country, we begin with an intake worker and then it gets transferred to an ongoing worker if the case is going to stay open with the Child Protection Agency. So when the professionals that have carriage of the case, when they change, maybe helpful to have a case review, make sure everybody is up to speed on the same page. Or where progress has not occurred as anticipated. So there may have been plans that everybody had agreed to, but for some reason those plans have not moved forward, and case review may help to get things back on track. And particularly in cases of sexual abuse, but physical abuse as well, where reunification may be considered. Bringing the professional group together, the MDT, to talk about that is important. So I'm going to move on now and talk a little bit about training and professional development for the MDT. This is something that can begin really at any time. You don't actually have to wait until your center is open to begin to do this, but it's also something that needs to continue once the center is open. And I think you can't underestimate how important ongoing and relevant training and educational opportunities are, particularly across disciplines. Before our center was open, we identified who the MDT professionals were who were going to be working in the center, and we began to train them together as a group prior to opening. So by the time the center was opened, they knew each other, they had spent time together, they had a better understanding of each other's roles, and they had a pretty good idea of what their roles were going to be going forward in the CYAC. So we did some training around the model, we did some training around forensic interviewing. Once we opened the center, we did some training around vicarious trauma and looking at ways to mitigate that. And now that we're coming to the end of our third year, we have, the past year now, provided facilitated peer review sessions for investigators. So our police and child protection workers meet with an outside facilitator to look at their recording interviews, they look at each other's, they don't look at their own, and provide feedback on how they've asked the child questions, what things they might have done well, what they might have been able to do differently. And that's been, initially everybody was a little apprehensive. That's been incredibly important and has really facilitated their skill development. It's also important, I think, to hear from the staff that are working in the center what they identify as professional development needs, and to be responsive in looking at how to meet those needs, whether it's system by system or whether it's the professionals together as a whole, but creating opportunities for identifying ongoing learning. And then I think this probably is stating the obvious, but and this is true, I think, in any kind of work environment or any environment for that matter, we need to create an atmosphere of trust and respect so people do feel safe talking to each other, so they feel comfortable sharing information and asking questions and making suggestions. And no one system working in a CYAC should feel that they have a more valuable role than everybody else. Really, the culture needs to support the belief that everybody has a contribution to make, everybody's role is important, and really only by working together in that way can the center accomplish the goals that it set out to do. So just before we get to the end and I leave some time for questions, one of the things people often ask about is, what about the community outside of the CYAC, outside of the professional stakeholders? How do you educate your community about your center, and particularly in terms of if you're looking to leverage support for fundraising, and I think even in a more basic way, creating investment and ownership in protecting the children in your community. So finding ways to educate your community, I think, is important, and not just community members, but other organizations in your community who may not be delivering service in the CYAC, but have a role to play in some way. So hosting information sessions for stakeholders, inviting people to come, doing presentations, talking about what the intention of the center is, and ways that people might be able to contribute. A number of centers now, particularly in the U.S., but some in Canada as well, have started to look at how to include prevention programs in their centers. And that may be holding information sessions for caregivers about internet child exploitation safety, or how to teach your children about child abuse prevention. So there's a number of ways that you may want to look at engaging your community. You may want to issue a media release, and you need to think about the timing of this. You want to do this at critical times because the media doesn't pay attention to everything, and you don't want to waste your opportunities. But for example, if you were to bring together all of the professionals that were going to be involved in your CYAC, and everybody signed, an MOU or a letter of intent to say, okay, these 12 agencies or 6 agencies or whatever it might be are committed to working together to make our city, town, province a safer place for children. And we're going to do this by creating this Child and Youth Advocacy Center model that's going to provide collaborated, integrated service. So media releases can be valuable. Going to existing community meetings and networks, your town council, and talking about what your center is going to do and what it's going to be. You can also, in addition to the media release, you can contact local media, whether it's radio, television, print, and share information about your center and what your hopes for it will be. When you open, you can hold a launch. You can invite the community and the media to come at that point. You can also, once the center is open, one of the things that we found is a very powerful tool, particularly in fundraising, is inviting people to come for tours, inviting them to come, talking about what you do, talking about what's unique about a child advocacy center, and that it brings people together to work in a much more integrated way than we have historically. So you can invite your funders, you can invite politicians, maybe just people in the community that you want to talk to about what you do. That gives you an opportunity to show how the model works and to explain what's different in a CYAC compared to the way investigations might have been previously conducted. And there's some other tools that exist there. There's some short videos that centers have used, have borrowed from other centers and made their own. So there's lots of different ways that you can share information with the broader community about what you are doing or what you intend to do. Collecting data can be very valuable as well, especially if you can show the benefits of the center. And this is a challenging one, and something that some centers have just begun to look at is how can you show, particularly how can you show cost savings. And I know the Sheldon Kennedy Center has done a study and presented some of the results of this recently, and may be willing to share information about how they've done it, but looking for concrete ways to show that the center is making a difference, or that the model or the approach you're using, whether if it's not a physical center where everybody's in one location, is making a difference. So evaluation, finding ways to collect data. In Ontario, we have developed a tool that we're going to use collectively, 6 different centers to collect data. That may be something down the road that would be available to other centers, but there may be others that you know of that have measurements or tools that they're using to collect data that you may be able to borrow from. And then finally, testimonials from children and youth and their families. So even a simple survey that can be provided online or in print to kids and families to ask them about what their experience has been at the center can provide some really powerful information that often can be useful in many ways. So I just included, to finish up, a couple of quotes and a few pictures of some of the rooms in our center. So this one came from a caregiver who said having all of it under one roof so we didn't have to keep repeating the information or search out services was very helpful and made dealing with everything much easier and less emotionally draining. This is an excellent program, and you can tell that everyone involved really cares about the clients and whatever the needs are. Thank you so much. And just on that point, I perhaps should have mentioned earlier, one of the, I think, most valuable components of an effective multidisciplinary team is people who want to be there, or people who want to work in this way. When our police service began to identify the officers that would work in the center, they put out a call across the city. They had 3 times as many applicants as they had positions for. So the police that are here are police that want to be here. And I remember having a conversation with somebody in the States about this, who was very surprised and said she hadn't heard of one center in the States where officers weren't just told you have to go and work there. So when you have people who are passionate, who care, who really are committed and believe in the model, makes a world of difference. And then just one more quote about the medical process. The medical was not what I thought. It was comfortable for my daughter, and it made the experience more kid-like, and I was nervous when it was being done since the nurse explained it to me. The advocate was still there when everyone else left. I knew if I needed anything, I could call her and she would help me and my daughter. So it really, I mean, the place itself and having things in one place is important. And, in places where that can be accommodated, it's great. I realize it's not always possible everywhere, but it's really the people. It's really the team working together that makes the difference. So that is the end of the formal presentation. I'm happy to try and answer any questions that people have. No questions? Okay, so I have one here. When you say you do many interviews in schools, does this mean forensic interviews? What do you do about recording the interviews in school? So yes, I am talking about forensic interviews, and these would be in cases where it's problematic to bring the child to the center. So we have mobile equipment. Our team would work exactly the same way that they would work in the center, but they would go out to the school with a camera, and they would record the interview in the school. And we've heard mixed reactions from kids. It seems like the older kids are not as comfortable with this and don't like the fact that other students may identify or recognize that they're being interviewed. But our police, of course, are in plain clothes, as our child protection workers are, and they try to be as discreet as possible. But yes, they do take mobile equipment and do forensic interviews in schools. Any other questions? Okay, well, if not, thank you very much for your time. I hope that it was useful, and there'll be information coming out, I guess, in the next little while about what the next webinar is that will be offered. Well, it won't be me; it'll be somebody else next time. Okay, thanks everyone. Have a great day.